Where we are today is here, no matter how long it took us or what circuitous road lay before us. Where is here? Here's where we chose to work in a kind of general medical specialty where questions about pain and difficulty apply to both body and soul. Here is where labels cause more disability and suffering more than the actual virus that runs through the blood. Here is where sometimes we are the only ones who know what's going on, and we can't tell a mother that her son needs her now more than ever. Here is where we talk about death and dying with young people on the first day that we meet. In medical school, we were told to have a certain kind of detached empathy when taking care of patients for our own self-preservation. Providers who feel too much are criticized or stigmatized as weak, and we find this mandate quite challenging in our daily encounters. And we have more than 3,000 reasons. Each reason is a person. A young man or woman who came into our lives because of a virus that changed their lives forever. Where we are now was always in the plans. Things happened that made it inevitable that we take care of people living with HIV. Until one day, we all found each other. We met people who, like us, wanted to take the road less traveled so we can save lives. This meant giving up careers in hospital work or corporate work in academe to find out a way to reach the most difficult to reach, young men and women in the Philippines. And together, we started out on a 20 square meter space in Mandaluyong. We painted the walls one weekend with common friends who wanted to give back to the community, placed some paintings of animals on the walls, got some colorful chairs, and set up the first SHIP clinic. The first ever community-based public-private partnership HIV service delivery model in the Philippines. And all we wanted back then was a place where people wouldn't be afraid to get an HIV test and to get into treatment. Fast forward 12 years later, we are now over 3,000 strong. SHIP Clinic, though, is still in the same place, but now we added more chairs, more room, more colors, and 3 more sale clinics. We are here today to welcome the latest in our crew, Sale Kalamba. And yet each SHIP and sale clinic rings with laughter and joyous sounds, mostly from care providers and patients, finding a way to laugh about something during the day. And it's exactly what we dreamed it to be, a place where the fear of having what was once a death sentence is now reduced to a condition one just has to live with, take medicines for, and not a barrier to realize one's own dreams in life. And now SHIP has grown then to expand beyond healthcare delivery to research, training of doctors, capacity building, innovations in healthcare delivery, and working with the government in advising health policy.
I'm handing the microphone over to Kate for at least the next 2 minutes, preferably 5.
Ano ba?
Okay, here you go.
I gave the whole floor to Tony today.
Come on, let it be the Tony Show.
No, please.
Tony show.
It's not. It can't be. It must not be.
I will be here to, let's see, carry out Tony's thoughts into hopefully action. There have been some minimal steps towards his ambitions, but yeah, we're moving at a very, very slow pace. Nothing like his predictions of how things should be. I always told Tony that the things that he wanted us to do actually eventually came through.
Yeah. But before you know it, you're there. The slowest things to me are the ones that are most sustainable.
He's very ambitious.
6 months.
He did CBS, so now it's signed form by the government, community-based testing using rapid test kits. Now it is endorsed, but at that time we thought it was a crime and he was handing out the test kits to everybody else. He wanted to do self-testing. Now there's a pilot project for self-testing that is just about to begin. So he's very advanced now. He's leaps beyond everybody's ambitions.
We'll carry it to the finish line.
Yeah, so that's what we're going to do. Is we're going to
That's the one that I took when I
get
went
all
to
of
see
those
you.
things from your brain, put them on paper, and hopefully make it happen.
Yeah,
I don't think we would have gotten here without you, Tony. You can be educated since day one, right, Kate?
Yes, that's true.
So you pay me the greatest compliment, sir.
The rebel. You're the rebel.
Oh, you deserve it.
Well, you're a silent rebel that will ring through the ages. Fear not. And I will sound your clarion.
Okay, no statues, please. Autographs maybe, but no statues.
The friend who we worked with before, who thought up this whole thing, is gone now. He died on Valentine's Day 2 years ago, a day before his birthday. The person who dreamed that the road less traveled would give us a heart that is always full is now gone, but his dreams, our dreams, are still there, and we will work to achieve them. All we do at Ship and Sail is to try to uplift the lives of people living with HIV. Many people living with HIV in the Philippines come from the most stigmatized sector of the population. Stigmatized for carrying a disease that society blames them for, stigmatized for being gay, for being a sex worker, or for doing drugs. But what we don't know is they are your children, our children. They did not choose to have this disease. In fact, people living with HIV would do anything to rid themselves of this virus in their blood. What we don't know is that they deserve to be treated like everyone else, with access to competent and affordable healthcare and providers with empathy. My friend said our hearts would be full, and he was right. And sometimes it overflows, and we all made it to the right choice that we made 12 years ago.